Hello, everybody, and thank you for joining. We're going to give everybody just a second to get in here, and then we'll go ahead and get started. Great. Welcome, everybody, and thank you for joining us for this webinar today. My name is Sam Klawicki, and I am the Communications and Marketing Manager for the Walk Cares Fund. I am joined today by Sebastian, who's the Walk Cares Fund Outreach and Language Access Lead. Together, we'll be hosting today's presentation. The DSHS customer care team will be answering questions in the Q&A function during this presentation and will be joining us later for the Q&A portion of the webinar. Anybody who has joined us on a computer or by using the Zoom app on their phones can submit a question through the Q&A function at any point during the webinar. And we'll be asking the questions during the Q&A session later. If we're unable to answer your question during the allotted time, we'll email you a response to the email that you registered for today's webinar with. This webinar will be recorded. The recording, along with the slides, will be available on our website at wcaresfund.wa.gov/webinars within 24 hours of the completion of the presentation. Now I'll pass it along to Sebastian, and he'll start the presentation by defining long-term care and caregiving.
Awesome. Thank you, Sam. And hi, everyone. It's great to be here. Like Sam mentioned, we're going to start with sort of defining and getting a sense of what we mean when we talk about long-term care and caregiving. We'll provide sort of an overview of what long-term care looks like in our state, family caregiving particularly, and its impacts. And then in the sort of the second half of the presentation, we'll focus in on the Walk Cares Fund, of course, and sort of how it works as well. So just to give that overview before we jump in here. So long-term care and caregiving. Long-term care can be defined as help with activities of daily living. That can be either bathing, eating, dressing, preparing meals, grocery shopping, as well as many other activities. But it doesn't include medical care, right? So things like doctor's visits and treatment for medical conditions. Long-term care covers a broad spectrum of needs and circumstances, and that includes younger people who have been unexpectedly injured or become disabled or ill. And a lot of people don't realize how many different services and supports are included when we are talking about long-term care. So we might often think of it as care in a residential setting, right? That could be a nursing home or assisted living, but it can also include care provided in our own homes. And most people with long-term care needs can stay in their own homes with the right types of supports. Moving on to family caregivers and caregiving, it's very common for family caregivers not to realize that they are a caregiver. So for example, you might go to your mom's house a couple times a week to cook meals, maybe drive her to appointments, make sure she's taking her medications, all of which are very common care activities, and again, can maybe go unnoticed, right, or not recognized as care activities. And the majority of this type of care is provided on an informal basis, meaning that it's unpaid care from a family member, could also be a friend, a neighbor, a loved one. So we are going to launch a poll here just to get a sense of what your all's experience is with long-term care and caregiving, and also how familiar you are with the Walk Cares Fund. So if you join by computer or the Zoom app, please go ahead and answer the questions, a couple questions that should pop up on your screen, again, just to get a sense of where we're at with our awareness experience around caregiving, long-term care, and also with the Walk Cares Fund. I'll give you all about a minute here to complete that, and we'll take a look at our results. All right, so it looks like we have our first results in. For the first question about our experience with long-term care and caregiving, looks like most of us work in long-term care or a related field, so very direct experience there. We also have a large group of folks who have provided unpaid care to a family member or loved one in the past. Again, so very direct experience and familiarity with what family caregiving can be, right, or long-term care in general. Some of us, less of us have maybe no direct experience, right, or maybe not familiar with long-term care. So great, thank you for that. And also just in terms of our familiarity with the Walk Cares Fund, already looks like more than half of us are somewhat familiar. So maybe we've heard about the program, maybe we've attended a previous webinar. And then another group that are not familiar, and then less of us that are very familiar. So hoping that the information provided today will definitely help increase that familiarity with the program. Um, so thank you all again for taking that quick poll there. And really, what this shows is that a lot of us and most of us, especially in this group here, we have care stories, right, in our families, in our communities, and a lot of us in our work as well. So family caregiving particularly is the bedrock of long-term care. So we have about 820,000 family caregivers in the state of Washington, which comes out to about 11% of the population. So we want to share a story here from a Washington family doing the kind of caregiving that Walk Cares will support. So this is Sunny and Yunny, sisters and nurses who live in the Puget Sound area, and they care for their mom, who has experienced some cognitive decline. So let's go ahead and take a look at their story here.
My mom was a nurse anesthetist in Korea, and we're both nurses, so it kind of runs in the family.
That was part of the reason why we were able to come here in 1974, because she had worked as a nurse and they wanted nurses to come, so she was able to bring the whole family.
Just a couple years ago, we started noticing that my mom started to have some cognitive decline, kind of on the spectrum of dementia. Yunny and I have had to kind of put our jobs on the back burner to really help take care of my mom.
Some days were good, some days were very difficult. I mean, it's our mom, and there's nothing I wouldn't do for her to make sure she stays as independent as possible with the support that we can give her.
If we had a resource like Walk Cares, that would have been so helpful to just kind of ease some of our financial burden in trying to do this. It's very difficult. So we try to simplify her life. We do her grocery shopping, and she often will come with us, and cooking, cleaning, cutting her hair, taking her out socially, but we're creating meals that she is familiar with and that she enjoys. And we like to bring her out to do fun things too, and not just like all medical all the time. Believe me, it will affect you, whether you're younger or older, to have a resource like that and to know that the state is investing in families. That means a lot to me. Walk Cares is a program that I think will benefit everybody.
All right. So next we're going to talk about some of the costs associated with long-term care. Again, a lot of you are familiar with long-term care and caregiving directly, so I assume you're familiar with this portion as well. So 7 in 10 of us, or 70% of us, will need long-term care at some point in our lives. But the problem is that long-term care can be really expensive, right? So it costs just about or almost $23,400 for 6 months of 20 hours of home care per week. And it's also important to keep in mind that family caregiving isn't free either. And again, we'll talk about some of those costs here in a second. But because long-term care, like we mentioned at the beginning, is not medical care, it's not covered by health insurance or Medicare, except in some very rare circumstances. And it's only covered by Medicaid after you spent down your life savings to just $2,000, right? So it's not really somewhere that any of us would choose to be in, right? That's kind of an emergency scenario. And even though, right, we talked about 7 in 10 of us will need long-term care, so it is a predictable cost. It is the reality is that most of us, excuse me, don't have a way to pay for it. So if we look at the median household income for Washington seniors, which is about $56,000 per year, 41% of Washington workers near retirement have no projected retirement income from a pension, a 401k, or IRA. And then another 42 have no pension and only enough 401k or IRA savings to replace just 10% of their pre-retirement income. So those numbers on their own are relatively right important, but if we combine those groups, that means that about 83% of us, or 83% of Washington workers specifically, between the ages of 55 and 64, have no pension savings, right, or very little to replace their pre-retirement income. This is also really important to keep in mind when we consider our population and how it is also aging rapidly. So if we look at the graph here, not to sort of walk through each line, but just to focus on that red line that we see sort of going up, that is the population that is 85 and older. And that population group will quadruple from 2025 to 2050. On top of that, we also have what's called the caregiver support ratio. Basically, is the amount of, as you can see, right, potential family caregivers for each person who may need care. This ratio is also declining sharply, so that really just means a lot less family support will be available for folks in high risk years for needing care. And then family caregivers will be more likely to be providing care for multiple loved ones at a time. So really, as a society, we need to provide better support for our family caregivers and find new ways to help families with these long-term care needs. So the impact of family caregiving, right? And it's not free, as we know. Um, Walk cares may seem like a new expense for workers, but it is important to keep in mind that the current system of relying on unpaid family caregivers to provide the vast majority of care isn't free for those families either. So almost half of family caregivers experience some sort of related financial setback. Caregivers also spend an average of 25% of their own income on care-related expenses. And it's really common for caregivers to leave the workforce early to provide care. So caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits. And most working caregivers say a program that paid them for their hours that they provide care, like Walk Cares, would be helpful. It also has a big impact on businesses and workers. Washington State, like the rest of the country, is experiencing a labor force shortage. So job openings are increasing, but the number of available workers is not. With this kind of shortage, it's critical to keep as many people as possible in the workforce. And of course, care responsibilities have a big impact on that. So we see here some of those impacts. The majority of caregivers work full time on top of their care and family responsibilities, and most reported impacted their job responsibilities in some way. So over half say they have to go in late, maybe leave early or take time off to provide care. 15% reported reducing their hours, and about 8% reported receiving warnings about the performance or attendance also maybe having to turn down a promotion, quitting, retiring, or losing benefits. And while many caregivers find their role as a caregiver rewarding, it can also be highly stressful, right? So nearly 1 in 4 report that their health has worsened since taking on their role as a caregiver. Long-term care is also a significant driver of the state budgets and accounts for roughly 8.9% of the state budget. So we may not often think about it in these terms, but these costs are paid for by all Washingtonians through taxes on goods and services. And as our population ages, as we saw in the graph earlier, those costs will rise accordingly. So without the Walk Cares Fund, sales on other taxes would have to go up significantly in order to meet those needs for our aging population. So with these challenges in mind, and also a projected doubling of the Medicaid long-term services and support costs by 2040, Washington State's Joint Legislative Executive Committee on Aging and Disability began a search back in 2014, at the beginning of this timeline here, for a long-term care public policy innovation that would preserve and protect the Medicaid program budget, that would offer affordable LTSS or long-term services and supports insurance coverage, provide financial relief to middle-class families and their caregivers, and of course be financially viable and sustainable over the long run. So after several years working with different stakeholders, policy experts, and actuaries to explore both the private and public solutions, they found that the Walk Cares Fund, a program like the Walk Cares Fund that covers everyone, so similar to Social Security and Medicare, is the only way to provide affordable coverage for Washingtonians. We also know that universal coverage, so where everyone participates in the program, is a best practice in public pension, healthcare, and long-term care insurance programs in other capitalist countries throughout the world, because it ensures programs can cover everyone at a low, stable rate, regardless of their age, gender, or health status. So with that research and best practice in mind, in 2019, the legislature enacted the LTSS Trust Act, created the Walk Cares Fund. In 2022, the legislature made improvements to the program's coverage and benefits. Workers began earning benefits in July of 2023. In 2024, the legislature gave workers the ability to take their benefits out of state. This year, so 2025, the legislature created a market for supplemental private insurance policies that will work seamlessly with Walk Cares, and additionally gave workers who currently have a private insurance exemption a window to join Walk Cares. We will be covering some of these updates and other updates that the legislature created and signed into law. So we'll be covering those towards the end of the presentation. And in July of 2026, the benefit will become available to those who qualify. So let's take a look at how the Walk Cares Fund can help and also how it works. So Walk Cares is a universal long-term care program in Washington State. It's an earned benefit, so that means that you contribute for a certain number of years to qualify for benefits. It's entirely self-funded from worker contributions, which go into a dedicated trust fund that is used only for this program. And workers contribute 0.58% of every paycheck to Walk Cares. So we can see there at the bottom left what that looks like for a typical worker who makes just over $50,000 a year. They would contribute $291 each year, or what comes out to $24 a month. And you only contribute while you're working. So contributions stop if you retire or if you become unemployed. And like we mentioned, everyone is covered at the same rate, regardless of any pre-existing conditions. So when it comes time to claim benefits, there are no copays, no deductibles, and you never need to file a claim or pay up front for services. Instead, we will connect you with the contracted providers for the services that you want, and Walk Cares will pay those providers directly. And like we also mentioned, contributions to the program began in July of 2023, and benefits will become available in July of next year, 2026. So really just to get a sense of what contributions can look like over the course of 30 plus years, right? Someone's potential career length. Again, the typical worker there in the middle column earns just about $50,000 a year. We said that that comes out to $290 in a year. Over the course of 30 years, right? Someone who earns that amount of money over 30 years would contribute $8,700 to the program. And we see at the bottom there that the full benefit amount is $36,500, which is adjusted annually up to inflation. So almost all Washington workers contribute to walk cares. To determine whether someone counts as a Washington worker, we look at whether their work is localized in the state of Washington. So determining whether who is localized in Washington can be complicated, but we use the same definition as the state's paid family medical leave program, so that gives us an easy rule to work from, which is that workers who are included in paid leave will also be included in walk cares, unless they have an approved walk cares exemption from the Employment Security Department. So you can check your pay stub or ask your employer for more information as well if you're not sure whether you participate in paid leave and walk cares. If your work is not localized in Washington, you are automatically not included in paid leave or walk cares and don't need to file for a walk cares exemption. Federal employees are also automatically not included. Employees of tribes are only included if the tribe chooses to opt in, and self-employed folks are only included also if they choose to opt in. Some other workers can get an exemption from walk cares and must apply to the Employment Security Department to get those exemptions. Some workers can apply for an optional exemption based on meeting some certain conditions. So this includes workers who live out of state, temporary workers with non-immigrant visas, and spouses of registered domestic partners of active duty military. These were exemptions that were created for groups of workers who would be unlikely to qualify for and use their benefit and are available on an ongoing basis and are conditional, meaning that the person must continue to meet those exemption criteria to maintain their exemption. I do just want to note that for the group of temporary workers with non-immigrant visas, they will be automatically exempt starting in January 1st of 2026. So again, this is one of the new changes that came from this last legislative session and now signed into law. And we'll cover it towards the end. But again, temporary workers with non-immigrant visas will automatically be exempt starting January 1st of next year, unless they notify their employer and they would like to participate in the program, then they will start contributions, but otherwise will be automatically exempt January 1st of 2026. And lastly, there are two types of permanent exemptions. So veterans with a 70% or higher service-connected disability rating who have access to some nursing home care through the VA can choose to apply for a permanent exemption. And these applications are available on an ongoing basis. And there was also an exemption available in the past for workers who had private long-term care insurance before November 2021, but these applications are no longer available. So if you are a self-employed worker, you can choose to opt into the Walk Cares Fund and also protect yourself with the same affordable benefits that are available to other Washington workers. So just like other workers, you contribute 0.58% of your earnings. And this includes your net earnings and any gross wages that are paid you from your business entity. So in order to earn benefits, you must work at least 500 hours per year. And for self-employed folks who elect coverage, this is calculated by dividing your gross annual wages by the current minimum wage. And applications to opt in became available in July of 2023. So these are the three pathways to qualify for benefits. Again, everyone who is contributing to Walk Care's fund more than 500 hours per year is earning benefits, and that includes part-time and temporary workers. So by contributing for a certain number of years, you earn access to the $36,500 benefit. So the first pathway on the left there is a lifetime access pathway, which we expect the majority of Washington workers will use to qualify for benefits. So for this pathway, workers must contribute for at least 10 years, and then they will earn access to the full benefit amount, again, $36,500 adjusted for inflation. The next is the early access pathway. This is particularly targeted for workers who maybe have not yet earned their lifetime access, but have a care need while working or maybe soon after leaving work. So they will need to contribute at least 3 of the past 6 years at the time that they apply for benefits. And this pathway will also earn you access to the full benefit amount. And lastly, we have a special pathway that was created just for people near retirement. So this is intended for folks who are born before 1968 and are therefore near retirement, and as the program begins next year, right, and unlikely to qualify for that 10-year pathway. So they will earn 10% of the full benefit amount for each year that they work. For example, let's say that they work and contribute, right, for at least 500 hours per year for 3 years, they would earn 30% of that full benefit amount, which comes up to just under $11,000. This is, again, a lifetime benefit that is adjusted for inflation. Um, so near retirees will have, again, permanent access to the percentage of the benefit that they earn and at the time that they need care. They can, of course, also qualify for one of the other pathways if they meet those requirements. So maybe someone retires, right, and starts their own business, becomes self-employed. They could choose to opt in as someone who is self-employed and continue earning those qualifying years. So once those contribution requirements are met and someone needs help with at least 3 activities of daily living, they can get access to, again, the 36,500 worth of services and supports. With Walk Cares, workers get the flexibility and freedom to choose the services and supports that meet their specific needs. So that could be in-home or residential care, but could also include things like home modifications to make your home safer. Could also be personal emergency response systems, nutritious meals delivered to your home that can help with some of those care needs. Walk Cares is really designed to help people age in place in their own homes as long as possible. And that's what most of us want to do and can do if we have the right types of supports in place. Walk Cares has also many options to provide support for family caregivers. So you can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid for their time, right? And that includes your spouse, but can be, right, a loved one, a neighbor. Um, that will, of course, help lessen the impact on family caregivers by paying them for their time and making sure that they can get access to other support services. So we do get asked a lot about how far the benefit will go, and it won't cover 100% of the care for everyone, but it would cover the amount of in-home care that the average Medicaid client uses for roughly a year. So about a third of people need care for a year or less, and for those people, Walk Cares may be able to cover that need. And for others, Walk Cares provides the family with immediate relief and also time, right, to plan for future care costs. So some of these examples of how someone might use their benefit, they could pay a family caregiver to care for them for 10 hours a week for 2 years, and get care supplies for about 34,800. They could choose services to help them stay safely in their own homes, right? So we talked about home modifications. They could purchase $8,000 worth of renovations, like a wheelchair ramp and widening doorways to improve their home accessibility, get a personal emergency response system, and have meals delivered for 3 years for around $36,084. Or someone maybe who has a long-term care need due to an unexpected injury can get 20 hours of in-home care per week for 6 months, and plus an environmental modification like a wheelchair ramp and safety equipment for about 28,900. So we mentioned the program update from 2024 that allows folks to take their benefit with them if they move out of state. So under this new law starting in July of 2026, again, Washington workers can choose to continue participating in the Walk Cares Fund if they do move out of state. So in order to become an out-of-state participant, workers must have contributed to Walk Cares for at least 3 years, in which they worked at least 500 hours per year, and must opt in within a year of leaving Washington. And just like other workers, out-of-state participants will keep contributing to the fund during their working years. And the state is creating and working on creating a process for out-of-state participants to report their earnings and pay premiums. Benefits will become available for out-of-state participants starting in July of 2030. And here we have some of the updates from this last legislative session of this year. So in May of this year, actually, so just last month, the governor signed a new law that expands Washingtonians' options for accessing long-term care support through the Walk Cares Fund. So we'll talk briefly about some of these here, or each one of these. So the first one, supplemental private long-term care insurance. This law creates new standards for private supplemental long-term care insurance policies that are designed to work alongside Walk Cares. So this structure is very similar to Social Security and how Medicare work. The public insurance provides a foundation of financial security for everyone, and then private options are available for those who want additional coverage. Because the Walk Cares benefit will cover the deductible, insurance would be able to offer supplemental plans that are much more affordable, which will, of course, increase access to long-term care coverage for Washingtonians. This has an effective date of May 1st, 2026. That effective date is for the Office of the Insurance Commission to complete rulemaking, and not the date that policies will become available. So I want to make sure that is clear. We also have another change, which is the opportunity for exempt workers to participate. This law provides an opportunity for everyone who has a private long-term care insurance exemption to be able to cancel their exemption and join the program. And this will be effective January 1st of next year. The new law also simplified the 10-year contribution requirement. So particularly the lifetime access pathway previously required workers to contribute for at least 10 years without a break of 5 or more consecutive years. So under this new law, the requirement is simplified to apply to all workers who contribute for at least 10 years, like we mentioned earlier. So this is really great for workers who maybe have to leave the workforce for an extended time while not having to restart their progress, right, towards earning their 10 qualifying years when they return. And we also have some additional changes that are also effective January 1st. So like we mentioned as well, those individuals who hold non-immigrant visas for temporary workers, those folks are automatically exempt. And unless that individual wants to participate in the program, they can do so, right, and notify their employer that they would like to. And there's also they also created an optional exemption for active duty service members working civilian jobs in Washington. And spouses of active duty service members will continue to have access to their existing exemption option. And final slide here before we get to the Q&A section. Walk Cares is a cross-agency program, and multiple state agencies have responsibilities in designing and developing and implementing the program. So if you have questions about exemptions or opting in specifically, ESD or the Employment Security Department would be the right place to go for those types of questions. Any other questions, you're welcome to connect with us, the Department of Social and Health Services. You'll also work with Department of Social and Health Services in the future as you apply for benefits and get a care need assessment. And then we see HCA, which is the healthcare authority, has a responsibility for paying providers. And then the Office of the State Actuary is responsible for ongoing analysis to make sure that the fund stays on solid ground financially. All right, and that takes us to our Q&A.
Great, thank you, Sebastian. Looks like we'll have about 20 minutes for the Q&A portion. As a reminder, please submit any questions that you might have using the Q&A function located at the bottom of your screen. If we don't have time to answer your question here, either live or through the chat, we will respond to you in an email through the email that you registered for today's webinar with. The first question is, if I have a recent injury, how can I apply for benefits today?
So benefits will become available to all Washington workers in July of 2026. So again, because they're available next year, folks aren't able to apply just yet. But if you had an immediate care need starting in July of 2026, then you might be eligible for that early access pathway again if there is an emergency care need, because you would have contributed 3 out of the last 6 years.
I am a retired worker. Can I contribute extra money?
So contributions again are that percentage for everyone. That's the same for everyone across the state. So it's 0.58% of every paycheck. And then the near retirees will of course have access to that prorated benefit amount.
How much money will I receive from this program?
So currently the full benefit amount is 36,500. That is adjusted for inflation annually. So that of course means that the full benefit amount will change, will increase, excuse me. And also for near retirees, right, we talked about the prorated benefit amount. So that will allow folks who, again, maybe just contribute since the program began in 2023 to earn a percentage of the full benefit amount. And that will depend on, of course, the amount of years that you contribute. But if for every year that you contribute as a near retiree, you earn 10% of that full benefit amount.
If you were initially exempt from the program, but your circumstances changed, are you able to opt back in?
So it would depend on the exemption type. I know there's we mentioned some of the permanent exemptions, but like we just more recently mentioned that there will be a window starting in January of 2026, January 1st of 2026 for folks who had a private long-term care exemption previously. If you have had a private long-term care approved, then you'll be able to choose to join the Walk Cares Fund. Yeah.
Can, sorry. I have lived out of state for 3 years, but I work in Washington remotely. I have never opted out and I do pay into the fund. Will I need to do anything after July of 2026 to opt in?
No, so if you are currently paying, if you work for a Washington employer, then you are contributing to the fund. Of course, if you live out of state, you have the option to opt out. But if you are currently contributing, like I think I heard in the example, then you will continue to contribute and will be earning qualifying years if you're working at least 500 hours per year.
If someone gets temporary care and utilizes a portion of their benefit and then goes back to work, keeps paying in, would they be eligible for the full amount later in life when needed, or only the remaining portion?
Right. So whatever benefit amount you earn when you have a care need, right, and have met the contribution requirements, that is again a lifetime benefit, meaning that you have that amount for your lifetime, and it's a one-time amount, so one-time benefit. So if you use a portion, you'll have the remaining amount.
I am moving to Washington this month and will be providing family caregiving for my mother-in-law. I am retired. Would we qualify for walk airs?
So folks that qualify are so the beneficiary, right, is the person who uh, has a care need, right? So if the person needing care has worked in Washington or yeah, has contributed and meets one of those contribution pathways, then of course they could earn the benefit amount, um, but not from someone who the caregiver isn't the one who necessarily can qualify for the benefit and use it to help their family, their person needing care, excuse me.
Can we get long-term care insurance now, or do we have to wait until next year?
Yeah, so I think that question may be referring to the supplemental coverage. That is, again, that is May of 2026 that the Office of the Insurance Commission will begin sort of rulemaking. So um, in insurance supplemental insurance policies won't be available to later uh, won't be available later than that. So until all that rulemaking is finished. So we will have updates as soon as we do have a specific date for supplemental policies and availability of those policies that will be shared. And we have, our newsletter, and of course our website is our great place to stay updated on all these updates.
How will the payments be made for services? Will services need to be a vendor who accepts walk airs fund?
Yes, but I would maybe like to follow up more specifically with that one, Sam, just to make sure we get the right information. I know there's a few ways for particularly right family members to become a caregiver, right, and sign up as a caregiver. Um, but I would like to just follow up to make sure we get that specific provider information to them. That
I can
answer.
add a little bit too.
Yeah,
All providers have to be registered, either through the state or through one of our partner agencies. Registration is going to be opening in October, and you can only use your funds with registered providers.
thanks.
Um, how are you able to, how much can you pay a family member? Do you know?
I think, do you have that one, Sam? If not, that might be one that I would want to follow up on as well.
Yeah, so there's maximum rates that you're allowed to pay for in-home care services, and once your family member becomes a registered provider, they'll be subject to those maximum rates. Do you have information on how the Walk Cares Fund works for undocumented workers?
Yeah, so it's similar to how if you're familiar with paid family medical leave, the paid family medical leave program, it will be a very similar sort of registration process and in certain terms of the documentation requirements, right? So it'll use the ITIN number primarily. Um, but again, it is very similar to the paid family medical leave program and those requirements. So,
If I have never contributed and am currently retired, can I join?
so if you haven't contributed and are currently retired, the fund again is available to folks that have contributed, and we walk through those contribution pathways. Um, so if you're currently retired then and not contributing, then unfortunately it's not available.
Sorry. There's so many questions. I'm just skimming through them. Um, Where can I find a list of services that the Walk Cares Fund will pay for?
Yeah, so there's on our website, there's a list of the services, covered services and improved services. So I would highly encourage you all to check that out because that does have a detailed list of those services.
How long do you have to pay in to be eligible to make a claim?
So we walk through those three pathways, right? So there's the early or the life excuse me, the one pathway that requires at least 10 years of contributions. And then another pathway, if you have an emergency care need, right, then if you have contributed for the last 3 years, or 3 out of 6 years, then you can also earn benefits, the full benefit amount. And lastly, that pathway for near retirees, so folks born before 1968 will earn a prorated amount for each year that they contribute.
Can you choose to opt out and forfeit future benefits?
So unless you are fall under one of those sort of exemption categories that we reviewed, and those are also available, I would say on our website to look at. Um, but otherwise, yeah, unless you're in one of those exemption categories or already have an approved exemption from the Employment Security Department, then all Washington workers are contributing to the program.
What is the status of the new legislation if I move out of state and still, so I can still obtain my benefit?
Yeah, so the out-of-state benefit. So if you contributed to the fund for at least 3 years and then move out of state, you have to opt in within a year of leaving the state in order to continue being right an out-of-state participant and continue to contribute and earn qualifying years. So if you, again, have contributed for at least 3 years and then opt in when you move out of state, then you will continue to contribute and then be able to earn your benefit in another state. Those benefits, I'll just quickly say that those are available in July of 2030, right? So a little later than when Washington workers will have access to their benefit. And that has to do, of course, with sort of setting up the policies and procedures for working with providers in other states.
How can you determine a prorated benefit amount for a near retiree?
Yeah, so for near retirees, again, anyone born before 1968, if they worked at least 500 hours per year, then they'll earn a qualifying year, which means that they earn 10% of the full benefit amount for each year that they qualify, right? So if, let's say, a near retiree contributions begin in 2023, July of 2023, if they retire in July of 2026, let's say, when benefits become available, and they worked at least 500 hours in each of those years, then they could qualify for potentially 30%, right, of the benefit amount. I think it comes out to around $11,000. So yeah, it's 10% for each year that the near retiree has contributed.
Quickly, I will say that we do have two upcoming webinars. One is Walk Cares Basics for employers, and one is Walk Cares Basics for providers. Some of these questions about exemptions and things like that would be great to answer for the employers webinar because our partners will be on that webinar co-hosting with us. And then if you have information about rates and becoming a provider or becoming a family caregiver, the what providers need to know webinar would be a really good one for you to register for and answer and ask those questions in. I put the links to both of those webinars in the chat if you want to register for those. The next question is if someone has worked and had their funds deducted for more than 3 years, would they still be eligible for benefits under the new law?
Yeah, so under the new law, the only change to the contribution pathways is that it eliminates it simplifies the 10-year pathway, right? So we now currently for the 10-year pathway, you just need to have contributed at least 10 years to earn the full benefit amount. Previously, that pathway required folks to not have a break of 5 or more years, but again, with the new change and the new law, that pathway is simplified to just say if you've contributed for at least 10 years, then you can earn um, the full benefit amount when you have a care need.
If we have a family member that needs help, can family members who contributed for at least 3 years pull those funds to help, or is it just one family person per household can use those benefits?
So the benefit is for everyone, right, individually. So as long as the person that as long as that person has met one of the contribution pathways and has a care need, which means needs help with 3 activities of daily living, then that person can earn their benefit. And that benefit can be used, right, to pay a family caregiver for their time, right, and that work. But it can be used, right, for each person that has a care need and meets the contribution requirements.
I think we have time for maybe one or two more questions. Do you have information on if the fund is sustainable long term or if the program will run out of money?
Yeah, so I know the from what I know, I'll speak to what I know, of course, but the actual analysis is sort of a long-term projection, right? For um, next 75 years, it's projected to be financially stable, right, and on solid ground. Um, and so again, it's always and there's always each year there's sort of course um, sort of revisit of that analysis to make sure that continues to be the case. So that's as much as I can share on the actuarial analysis piece of that. Yeah.
And I think that's all the time we have for today's Q&A. If you have, or if we haven't answered your question, we will be following up via email. If you do have a question specific to exemptions, I would recommend registering for the employer's webinar. If you have a question specific to becoming a provider, a family caregiver, or different rates for those, I would recommend registering for the provider's webinar. Sorry, following the webinar, everyone will automatically receive a post-event survey. It'll pop up on your screen. If you'd like to take a few minutes to share your thoughts about today's presentation, we would love to hear from you. As a reminder, today's webinar is recorded. You can find the recording and information about upcoming webinars on our website at wcaresfund.wa.gov/webinars. The recording, along with the slides, will be available within 24 hours. If you have any additional questions, you can contact us by phone or email with the information listed on the screen. Thank you all for attending today, and we hope to see you in a future webinar.
Thank you.